Everyone, my name is Ashley Wisdom, and I'm the co-founder and CEO of Health in Her Hue. Health in Her Hue is a telehealth and wellness platform for women of color looking for culturally sensitive and personalized care. And I'm going to tell you why women of color, and particularly Black women, are so excited about what we're building. Because of the racial bias that exists in healthcare, many patients of color prefer to connect with culturally aligned providers. But making these connections is difficult because the doctors of color are underrepresented in medicine. Black women are bearing the brunt of this problem. Systemic bias results in nearly 1 in 5 Black women avoiding care, going to the doctor because of the fear of discrimination. No one should be afraid of seeking healthcare, but Black women are. As a Black woman, public health expert, and someone who's worked in healthcare for almost 10 years now, I understand personally how painful this problem is. There are way too many headlines that talk about Black women's poor health outcomes and too few solutions that address their unique needs. The lack of targeted solutions for these women and other women of color is not only driving up healthcare costs, but it's costing these women their lives. In addition to the impact solving this problem will have, this is a huge untapped market opportunity. Although the femtech market is growing, there are very few solutions in the market that are targeting women of color and their specific needs. Women of color are willing to spend money on products and services that meet their unique needs, and they make 80% of the healthcare decisions in their households. In the past 5 months since releasing our MVP, we've heard many amazing patient reviews and stories, but one story in particular really stood out. A patient based in Texas wanted to find a Black gastroenterologist because her other providers were not taking her chronic issues seriously. This was so important to her that she drove 3 hours each way for a 30-minute visit with a doctor. No woman should have to drive 3 hours just to find a doctor who will take her concerns seriously. That fear is costly and it takes a toll on a woman's health. This is why we're building Health in Her Hue, and we're starting with a focus on Black women. Our platform will offer an integrated virtual women's health clinic designed to give Black women easy access to culturally competent healthcare providers. We will provide telehealth services related to women's health, and specifically, reproductive health, mental health, and dermatology are of the highest demand among our users. Our growing provider referral network, our content, and member community is how we've been able to engage and acquire users to date. We've built strong brand recognition and trust with our content. And when we released our MVP in late June, we had 34,000 logins in the first 2 weeks. We have users who are getting amazing results from our MVP, and they've been spreading the word on social media about the great connections that they've made with doctors through our platform. And providers have also been sharing that they've been getting referrals from us and have been telling their colleagues and their patients to use Health in Her Hue for referrals. One gynecologist in Florida told us that she gets at least 2 new patients a week since she's been listed on our platform. We've been able to grow organically and with no marketing spend, in large part due to the reviews and word-of-mouth recommendations from our users. Although right now we're focused on direct-to-consumer, we are already seeing interest from health plans, and we have one anchor enterprise client, Oscar Health, and are in conversations with several others. Health in Her Hue is at the intersection of femtech and telehealth solutions designed for people of color. Existing telehealth platforms that are focused on women's health aren't quite designed to meet the nuanced needs of women of color. And the existing telehealth and wellness platforms that are targeting people of color aren't focused on women's health. We have strong brand awareness, really engaged users, and we're well positioned to win this large and growing market and to improve health outcomes for all women of color. My professional and academic background is in public health. I've worked in healthcare my entire career, and my co-founder, Edwina, is a second-time founder with an MBA from Columbia University. Together, we are revolutionizing the way healthcare is delivered to better serve women of color. If you're a woman of color who's looking for a solution designed to meet your healthcare needs, sign up to be an early user and follow us on social media to get updates on our progress. And if you're a healthcare provider who's excited about what we're building, we welcome you to support our movement and mission to reduce racial health disparities and improve health outcomes for women of color. Thank you.